Hey you guys, welcome to my channel. I'm pharmacytechlove. This is where you'll be learning everything that you need to know about how to be a pharmacy technician. Hey, welcome back to my channel. I'm pharmacytechlove, and if this is your first time visiting my channel, make sure you subscribe. I normally teach everyone how to subscribe because a lot of people just don't know how. So what you'll do is you'll look over here where it says subscribe. So you'll click that first, and then these two icons are going to pop up. There's going to be one that has a bell, and I think there's going to be one that does not have the bell. I want you to click the one that has the bell. That way you'll be notified every time I post a new video. So today we are going to be talking about insulin and also insulin needles. I can't remember who requested it, but I will try to look down in the comments and let them know that I've created the video for it. So this is actually, I have a skills kit in my classroom. First, let me introduce myself. As I said, I'm pharmacytechlove. What I normally do is I teach individuals everything they need to know about how to become a pharmacy technician, just what to do in the field, and really how to conduct yourself as a pharmacy technician, because you do need to be as professional as you can be in the field, even though sometimes it is a little difficult, because once you get in the field, you'll make friends. You'll make friends with the nurses who call, depending on if you're in the hospital setting or the retail setting. So sometimes, everything kind of does get a little joking, around, but that's in every workplace. But as I said, I'm pharmacytechlove, and welcome to my channel. So again, today we are going to focus on insulin. This is just a Practi vial. I forgot to put lotion on. This is just a Practi vial of insulin. This is probably just saline water, or it could be water. I just got it out of my skills bag. I teach at a local college here where I live. This is also an insulin syringe. This is what it looks like. These insulin syringes, I believe, come in 3 different sizes. I've seen one that comes in a 50 unit. This is a 100 unit, and I'll bring this up closer when I start discussing this, because that's what someone was wanting to know, is actually how to read this, and it's really easy. It would have been a short video if I would have just showed this. It would have just been like 30 seconds. But I want to go into a little bit more depth about diabetes, because I have a best friend. She's a diabetic, and we really don't talk about it that much. I've never seen her give herself a shot, but probably one time. I'm 42, and we've been friends since I was 17, and I think she's like 52. She may almost be 60. I'm really not sure. But I've never seen her give herself a shot, and sometimes I completely forget that she's a diabetic because she doesn't talk about it. So let's talk about it just a little bit, because I actually had to educate myself. Okay, from what I found, there are 4 different types of diabetes, okay? Most people will probably tell you there's 2, but I had to do just a little bit more research, because I don't know anything about this, and I had to take notes. As you know, I always take notes front to back, but I had to take notes. Okay, so I'm going to tell you all 4. So there's type 1 diabetes, there's type 2, then there's gestational diabetes, and then there's pre-diabetes. So I'm going to go through this really quick, because I also want to show you on my board, on my dry erase board, how to calculate how to give, or how many days supply in a vial there is. So I'm going to be talking about 3 different things in this video. I'm going to give you my notes. I'm going to also show you how to draw up insulin in an insulin syringe. And then I'm just going to show you, all I did was I just had 3 problems that I want to show you, because I don't want to make my videos lengthy. Even though none of you complain about the length of my videos. I had one person to complain about that, but this is like a hobby for me. Why do I need to feel rushed about my hobby and something that I enjoy doing? Okay, so let's talk about type 1 diabetes. It has, from what I've read and the videos that I have researched, it has nothing to do with diet or lifestyle. It just happens, which I think is strange. Okay, it is the body attacking the insulin producing cells. We all need insulin to break the glucose down that enters our body, and what insulin does is it helps to break everything down so that it can give our body fuel. And the last thing about type 1 diabetes that I took notes on is that high glucose can damage your heart, your eyes, your feet, and your kidneys. I've always wondered why people get their toes cut off, or sometimes their legs, or from their kneecaps down cut off because they're a diabetic. Like my friend Valerie, whenever she goes to get her feet like a pedicure, like she's very, and when I say very particular, it's like I will break your neck if you do something bad to my feet. She's like that, and I get that, because I think that if she has a sore, if a sore creates on her toe or her foot, I believe that it's slow to heal. From what I've read in type 2 diabetes, those sores are slow to heal, and it may could cause an infection to where she has to get her toe cut off or her foot cut off. I know my grandmother on my mom's side, she had to get some of her toes cut off, but I'm not sure of the reason why on that. Okay, so let's talk about type 2 diabetes. It is where your pancreas cannot create or cannot make enough insulin, causing high glucose levels in the blood. Some of the symptoms of that is being tired, your cuts healing slowly. This is something that I didn't know, is that type 2 diabetes can go unnoticed for 10 years. That's risky. Okay, so and I read that you may become very thirsty a lot, and you may urinate a lot as well, as far as the type 2 diabetic. The third one is gestational. I almost said gas-stational. Gestational diabetes. It usually appears in women that give birth. And then pre-diabetes, it is basically a borderline diabetic whose blood glucose levels are higher than a normal person's, but lower than a person that is an actual diabetic. But it'll kind of be in between. Sorry, someone's passing by my house. It'll be in between basically, and sometimes you may become a diabetic in the pre-diabetic stage, and sometimes you may not. Okay. All right. So another thing that I wanted to look up was the difference between the two. Okay. So let's talk about type 1 one more time. It is an autoimmune disease. You develop symptoms early in life, and it can't be cured. And you also have a risk of falling into a diabetic coma. I have a friend that has passed away from being a diabetic, and he actually fell into a diabetic coma. And before doing this research, when I tell you I knew nothing about diabetes, and I still feel like this is just a small portion, because there's still things as sliding scales and different things like that I'm not a nurse, so I don't know about any of those things. Let's finish up with type 2. It is a metabolic disorder. Symptoms develop slowly and later in life. They can be avoided and even reversed. So both of these affect your body's ability to produce and use insulin. So that is the information that I gathered from looking online, from looking on different YouTube videos. Everything that I discuss with you guys, I always research it and try to do as much research as I can. This is what I do in my everyday life. I try to research everything. And a lot of people come to me and ask me questions about things that I have no idea about, and I just simply sit down. I'll take an hour out of my day, or 2 hours, and sometimes overnight, just to do a little bit of research, just to make sure that I can give people or individuals the correct information. So what I'm going to do now is I'm going to get my camera adjusted so I can show you how to withdraw insulin from an insulin vial with an insulin syringe. So let's get right into it. Okay, you guys. I think one alcohol swab will be good enough. So I'm just going to put my gloves on here. Like I said, this is just a Practi vial. It just says Practi Insulin Glargine. And it's supposed to be 100 units in 1 ml, which is true. And this is a 10 ml vial. So that means that there's 100 units every 1 milliliter. Okay, so if that's 100 units in 1 milliliter, and we have a 10 ml vial, so 100 times 10, because we don't have just 1 milliliter in this vial. This is a 10 ml vial. So it'll be 100 times the 10 milliliters, which then that is going to give us 1,000 units in this entire vial. Okay. So again, that's 100 units per milliliter. So that's just like saying 100 times 10, because there is 10 milliliters in here. So that's 100 times 10, which will be 1,000 units. So if this was a 3 ml vial, it will be 100 times 3 milliliters, which will be 300 units. Okay. All right. I just wanted to explain that because I know that my students get a little confused on that. So let me just grab another glove here, even though that, this isn't a real insulin, but I still like to do what's necessary. I still want to show you guys the proper way to do it. And what we do at my job is we put all of our insulin into our Pharmacist machines. We do not draw up any insulin ourselves in the pharmacy. I'm trying to make sure I'm in range here. We don't do any of that in the pharmacy. We used to. I remember that. That was a long time ago. But we don't do that anymore. I always tell my students, this is only a dust cover. This does not mean that the rubber is sterile. Okay, this is only a dust cover. And I've actually had to teach that to nurses as well, because you don't know where this has been once it's traveled to the United States, wherever it's coming from. I don't know if it's made in, China or wherever the heck insulin is made out of. And it may be in the United States, but who cares? But it's still not sterile. So we're going to grab an alcohol swab. If this is wet, and it is wet, it is moist. So I'm just going to give that one hard swipe. And there's a process, a drying process that alcohol does, which is called desiccation. So you're really supposed to let that dry off a little bit, which I've started putting alcohol into my mop water at home so it can dry my floors even quicker. But I know you don't care about any of that. Okay, so we're going to open up this insulin syringe, and I'm going to show you the graduation marks on here. Oh, as I was saying, we put the insulin syringes in our Pharmacist machine, and the nurses, they just go to the Pharmacist machine and they take out however many units that they need. And they do have to have another nurse to witness, because insulin is a hazardous medication. Okay, so as you see right there, it says 100 units, okay? So this is a 1 ml syringe, okay? Because as I showed you, it is 100 units in 1 milliliter. And that's what this is. This is a 100 unit syringe. So that means that it is 1 milliliter. It doesn't have the milliliters on here. It probably doesn't even have enough room for that. But here's sorry if I'm out of frame. I'm trying to look into my camera as I do this. So that's 100 units. It has it in increments of 10 on this side. And on the other side, it has it in increments of 5. Okay, like 5, 10, 15, 20, 25, 30. Like that. Okay. All right. So I'm going to uncap this. And with this, you don't have to go with the bevel up. And I don't even know if you even know what that means, bevel up and different things like that. But if you're taking a class, then you will. But with this, you don't have to do bevel up and go and hold it to the side and go straight down. With this, you will go straight down into your syringe. So I'm going to scoot this out just a little bit further so you can see what I'm doing here. So I'm going to pull back, we'll say 55 units. All right, let me scoot over just a little bit. So I'm going to just go straight down. And I do the scoop method. I take my 2 fingers here, because this is normally done in the IV room. Okay. So I take my 2 fingers here, and I take my 2 fingers there, and I hold it. This is like my foundation. Okay. And I hold these, I have these 2 fingers, trying to make sure you can see me here. I have these, this is what I was taught when I went to Houston. And I love this method. You have your 2 fingers here, your 2 fingers at the bottom, because when you're in that IV room, there's something called clean air. And you want that clean air to come through. through this area here where this point of contact. When you start covering it like this, because the HEPA filter is behind you. Well, excuse me, it's in front of you, but it's behind what you're manipulating. Let me say that. So you want to keep all of this area clean and free right there. I'm trying to look at the same time, clean and free. Okay, so now I'm just going to start pulling it down. I think I said 55. I can't remember what number I gave you, but that's a little tough to pull down. I'm going to pull this down to 55. I'm going to bring this in a little bit closer if I can. I'm trying to do all this at the same time. So as you can see, there's fluid coming down in there. I don't know if you can see that or not. There's fluid coming down in there. All right, so I've pulled it down a little bit too far, but that's okay. We can always push it back in there. So I'm going to stop this at 55. Right there at 55 units. I'm going to take that off. And as you can see, the fluid is in there at 55. Okay. I'm just going to put that back in there. I'm going to pull it to another number. Okay. So we're going to stick it back in. And we're going to pull this. Bear with me, you guys, because I'm trying to look into my camera at the same time as I'm doing this. Okay, I'm going to pull it now to 75. And it goes right on the line. Right on the line. So I'm going to start pulling. As you can see, the fluid is cut. Okay, now I can see it too. So I'm going to pull that to 75. I'm going to push a little bit of air back in there just to make sure there's no bubbles. Pull that to 75. It's got a little pressure in there. I'm going to pull it down just a little bit further. So now it's right at 75. I'm going to take that off. And that's at 75. I don't know if you can see that. But it's not going to be, a lot of people get confused that it's where the bottom line is. No, of course not, because you don't have fluid in that bottom line, because you have your rubber area here, this black rubber area. So it's, of course, the fluid stops at 75. So that's where you're going to count your units, okay? All right, so I'm going to recap this. And that's pretty much it. All right, so now we are at the dry erase board. I'm just going to teach you guys how to calculate. On this one, it's going to be the total number of units. So that's what we're searching for on this one. But listen, you guys, if you want to become a certified pharmacy technician, I will leave the link down in the description below. In the description, and I'll also leave it in the comments. I know a lot of you guys are always saying, oh, I've signed up with this program. Oh, I've signed up with that program. But what really confuses me a lot, and I think I talked about it in my last video, was you guys will email me questions that you should be asking your teacher. Okay, whenever you email me, it should be questions concerning the program that I am trying to offer to you guys, okay? Because I think that we have an excellent program. And I'm not just saying that, I mean it. I refer my friends to this. My friends sign up, my family sign up, anyone that I feel like that is needing to start a career, okay? Because as pharmacy technicians, we don't make minimum wage, okay? I don't make $7.25, which is, I think, minimum wage in Texas, I believe. I don't make $11 per hour, which I believe is minimum wage in Arkansas. I don't make minimum wage. So a lot of people are asking me, you know, well, I don't want to make this much. I don't want to make that much. If you feel like you want to make $30 per hour or $40 per hour, then you need to invest the time in and go to college and get a master's degree in whatever you feel like you want to get a master's degree in. But as far as pharmacy technicians, this is a great field that you can go into without having a college degree, even though I do have a college degree, but you don't have to have a college degree. So there it is. All right, so let's get into this. Like I said, if you want to become certified, I'll leave it in the comments. I'll leave it in the description. But just know that this job has supported me. I have built a home at the age of 28, and that was even before I became certified. When I first moved into my home, I was 28 years old. I became certified. I can't remember, y'all. oh God, I think I was 28. I'll have to do the math. But anyway, I became certified within probably a year, I think of being here in my home. I want to say I moved in my home in 2008, so I became a pharmacy technician in 2008. So I have a 3-bedroom home. I have 2 vehicles that are paid for. I am putting my daughter through college. What more do you want? I mean, support yourself. Support your life. All right, let's move right into this, okay? All right. Okay, so this is just something that I've made up. I'm not sure how insulin is given because I'm not a nurse. This says you're going to inject 3 units subcutaneously 3 times a day for 30 days. All right, so this is how I teach my students. So the first thing that I will write down, I know that I need 3 units, so I'm definitely going to write that down. They're going to be given this 3 times per day. Let me do this a little bit different. 3 times per day. So now we have a total of 9 units. Okay, that's per day. Per day. 9 units, okay? And we're going to do this for 30 days. Everything is multiplication for 30 days. Okay, so that's going to give us 270 days or units. It's definitely not going to give us 270 days because they're taking it for 30 days. So that's going to give us 270 units. Okay, all right. Let's move on to the next one. So how has everybody been doing? I hope everybody's doing well. My trip to Cancun was amazing. We had a really good time. It was really nice to be able to go with friends and enjoy myself, because I haven't enjoyed myself like that in a very long time, because I really don't go out that much where I live, because I don't know, I always like to keep an image of myself really good. Okay, so the second question is, how many 10 ml 100 unit per ml vials are needed to make 9 bags? We're making 9 bags. Okay, this is, say for instance, you are making a stock amount of these 100 unit per ml insulin bags. Okay, so you're trying to make 9 of these 100 units per 100 NS bag. So the 100 milliliters comes from the normal saline bag. Okay, that's just a vehicle. Okay, that's what we call it in pharmacies, a vehicle. So basically, if you don't know, you can have a 100 milliliter bag of just normal saline. Okay, and remember a 10 ml vial. I know my drawing is not at all up to par, so we'll just say that this is a vial. And in this vial, there's 100 units per milliliter, and there's 10 milliliters, okay? So we know that that equals 1,000 units, okay? 1,000 units, all right. So now, we're trying to find out how many bags we can make, well, or how many 10 ml vials, how many 10 ml vials is going to take in order to make these 9 bags. And each of those 9 bags is going to contain 100 units of insulin. Okay, so what I normally do is I think of have and I think of want. Have is going to be, I'm going to scoot this over just a little bit just in case it gets in the way here. I'm just going to put 1,000 and you'll know what that is, 1,000 units. Okay, so what we have is what we have inside of our pharmacy. And what we have inside of our pharmacy is this 10 ml vial, and it contains 100 units per milliliter. So we have, because I don't want to use that 1,000 into this problem. So we have 100 units per milliliter. And if there's not a number in front of your unit, you have to assume that it is 1. Okay. Now what we want to make are those 9 bags, okay? So we're going to multiply everything times 9. So if we have 9 bags individually, and each one is going to contain 100 units. So 9 times 100, we want 900 units. And remember, everything has to be adjacent to each other. If you have units here, you have units here. If you have milliliters here, you have milliliters here. So that's what we're solving for, is milliliters, all right? So everyone should know how to cross multiply and divide. So you're going to cross multiply this first, and you have to assume that this is the number 1. So it'll be 900 times 1 in your calculator divided by 100. So basically 900 divided by 100 is going to give you 9 milliliters. So you will only need 1 vial because this contains 10 milliliters and you need 9 milliliters. Okay, let's work out another one. This is the last one. I'm going to let you guys go. Okay, all right, this is our last problem. So this one says we're going to inject 60 units per day from a 3 ml vial of insulin, which is, the concentration is 100 units per ml. How long will the vial last? Okay, so we have to think about what we have, which I could definitely do this a easier way, but I'm going to show you 2 different ways here. Okay, so we're going to do, oh my tummy. Okay, we're going to do what we have and what we want. So what we have is going to be the concentration. Every time you think of what you have, that's going to be what you have inside of your pharmacy. Whenever you think about what you want, that's going to be what you want to give to the patient, all right? So what you have in your pharmacy, the concentration that you have is 100 units per milliliter. I'm just going to put 1 milliliter just because. All right, and what you want to give the patient is 60 units, 60 units. And the way that you know those units go on top is because you have units here, you have to have units right next door. You have milliliters here, you have to have milliliters right here next door. And we have no idea how many milliliters we need, even though that's not what we're solving for, but that's going to get us there, okay? Even though there's an easier way to get there, but I just want to show you 2 different ways because everyone's mind, everyone's brain does not work the same. So that's what I try to do with my students. I try to show them several different ways of how to get there, just in case one mind says, okay, that's easier for me, and then another brain says, that's easier for me. Now they have options. Okay, now we're going to solve for x. 60 times 1 is 60 divided by 100. So you would do, okay, sorry about that. My camera is acting a little funny. Okay, so you would cross multiply. And if you don't know how to cross multiply, reach out, let me know. I'll make you a video on how to cross multiply. Okay, so first of all, we're going to cross multiply the only thing we can cross multiply, which is 60 times 1. And then we're going to divide by the only remaining number that we have, which is 100. So basically it's going to look like this. 60 divided by 100 right there. So that's exactly what you're going to put in your calculator. So whenever you start putting these numbers into your calculator, I never want you to hit the equal sign until the end, okay? Really, you don't even have to hit your equal sign because you're doing 60 multiplication key times 1. Then you hit your division key divided by 100, and that's going to give you 0.6 milliliters, all right? 0.6 milliliters. So now, this is going to be per day. Remember, you have to always remember what your problem is saying. So this is 0.6 milliliters per day. And we have a total of 3 milliliters, all right? So we have those 3 milliliters divided by 0.6 milliliters, and that is going to last for 5 days. Okay, now another way that you can do this, I have something else written down here, is just simply, you can always rewind this if need be, because I'm going to erase this, all right? Okay, another thing that you can do, just to simplify this, excuse me, geez. Okay, you know that 3 milliliters, well, we'll say it's a 3 milliliter vial. And say, for instance, you plugged in 3 milliliters here, which would bring this up also times 3. Because whatever you do to the bottom, you have to do to the top. So let me just show you exactly what I mean. Say, for instance, you have 100 units here per milliliter. Whatever you did to the bottom, because now this is 3 milliliters, okay? Whatever you do to the bottom, you have to do to the top. So I multiply, because I brought this up to 3 milliliters, because that's how much it is, I also have to bring this up times 3. So that's going to bring that to 300 units in 3 milliliters. All right? So now we know that we have 300 units. So we would take that 300 units and we would divide it by 60, which is still going to give us 5 days. All right, let me know if you want me to work out more problems like this. These are actually really easy. You just have to take your time, pretty much. Just take your time and think about it. You have to dissect these problems sometimes because on the PTCB, they were really difficult for me. And that was just me teaching myself at home. If I had an instructor, I would have just flown through that test. I would have flown through it. All right, you guys, y'all have a wonderful day. Today is the 3rd, if I'm not mistaken. Today is the 3rd. So I'm going to try my best to upload this today if I can, which that shouldn't be a problem. You guys have a good day, and I will see you soon. Bye.